Good afternoon, everyone. Thank you all for coming here this afternoon. My name is Adam Lopakopoulos. I'm proud to serve as the Executive Director of the Alliance for Addiction and Mental Health Services. A special thank you to our legislative champions, Representatives Gramlich, Stover, and Crafts, and Senators Talbot Ross and Gore, for their leadership and commitment to strengthening Maine's behavioral health system. I also want to acknowledge today the incredible providers and member agencies joining us in the Hall of Flags this morning, as well as our wonderful partners, the Behavioral Health Community Collaborative, Maine, NASW Maine, and the Consumer Counsel System of Maine. We are all stronger when we stand together in this work, and today's event reflects the urgency and shared commitment we all have to improving access to mental health and substance use treatment for Mainers. I wanted to start today off by setting the stage on the state of behavioral health care in Maine today. Ever since coming out of the pandemic, Maine has experienced an unprecedented level of demand for mental health and substance use disorder treatment services. On top of that, we are facing a severe behavioral health workforce crisis that limits access to care and is leaving individuals and families struggling to get the support that they need. Today, thousands of Mainers are waiting for services, from children needing early intervention to adults seeking mental health and substance use disorder treatment. According to a recent workforce report with NASW Maine, the average wait time for organization-based mental health counseling in Maine is 8 months. As demand for behavioral health continues to grow, this is simply untenable for the folks that we strive to serve. That said, we have seen some positive momentum, and we are grateful for the close collaboration that we've achieved with our state partners. The moment before us represents a unique opportunity to make lasting and transformative changes. Just this month, our first 3 certified community behavioral health clinics, or CCBHCs, came online as part of Maine's federal Medicaid demonstration program. And transformative potential exists, particularly in children's behavioral health. Earlier this year, the state of Maine entered into a settlement agreement with the U.S. Department of Justice to improve access to community-based services for our youth. This moment requires bold action, sustained investment, and system-wide collaboration to ensure children and families receive the care that they deserve. You'll hear this afternoon from speakers on the critical needs facing our system and the priorities our coalition has identified to address them. Chiefly among them are workforce investments, children's behavioral health, and expanding access to mental health and substance use disorder services. We need enhanced career pathways, better training opportunities, and creative initiatives to recruit and retain professionals who provide life-saving care in our provider agencies. We need to do better by our children and expand youth community-based services, ensuring that children and families can access the right care at the right time and do so here in Maine. And we also must continue to enhance our entire behavioral health system of care, ensuring that those in crisis don't end up in emergency rooms or in the criminal justice system simply because they have nowhere else to go. I wanted to close up today by just saying it is absolutely vital that we continue advocating for policies that ensure sustainable, community-based, and person-centered care across the state. The time for action is now. We look forward to working with our legislative leaders, our community and state partners, and providers across Maine to continue our collective work towards building a stronger behavioral health system that works for everyone. I really want to thank you for your time today and everyone's commitment here in making behavioral health a priority in Maine. We're happy to answer any questions and pull off at the end of today's conference. And I now would like to introduce, and be honored to introduce, an exceptional champion of all things behavioral health, Representative Gramlich.
Good afternoon. Thank you for this opportunity. I am Lori Gramlich, and I'm very pleased to share that I'm the Assistant House Majority Leader, and I represent House District 131, which is the lovely seaside community of Old Orchard Beach. The issue of providing adequate, quality mental health services for Mainers has been a lifelong mission of mine. As a licensed master social worker who has worked in the field for nearly 40 years, I've dedicated my entire professional career to advocating for children and to ensuring that people of all ages have access to the behavioral health and mental health services they need and deserve. It has been my top priority as a 4-term state representative. For years, our mental health system has been in crisis. After years of stigma and neglect, we as a state have finally begun to make good investments that have resulted in some improvements. But we have a long way to go. Unaddressed mental health issues impact people across our state, in our schools, in our jails, in our emergency rooms, and within the walls of our family homes. People are in need, and we don't have the adequate resources to help them. As a social worker and a legislator, I'm particularly focused on our children. We all know that if we invest in prevention and early intervention, we can help people avoid a lifetime of consequences of unmet needs. Most importantly, this helps our children. And it also pays off in terms of avoiding more expensive costs in the future. This is why I am so focused on prevention and early intervention. It's also why I'm sponsoring legislation to provide more support to our kids, including my bill to increase the number of assertive community treatment teams. These are coordinated teams of nurses, psychiatrists, social workers, and aides that help our children get the services they need. It's also why I've introduced a bill to invest in the expansion of school-based services, and why I've sponsored a number of bills during my time in the legislature to ensure the availability of comprehensive mental and behavioral health supports so that no child is left stranded in an emergency department without the care they need, or sent out of state because they can't get that care anywhere in the state of Maine. That is unconscionable to me. Without the services such as these, we will continue to send our children far away from the needed support of their families and communities to receive the treatment that will help them. As a mom, I can't begin to imagine the pain and anguish a parent would have trying to get treatment for their child and being told they have to send that child miles and miles away from them, away from their support system. We can do better. Let's put Maine back on the map as a leader in meeting the needs of the children, of our children, and of our future. Let's give Maine kids the support they need right here at home. We are facing uncertain financial times, we all know this, but support of these bills in the long run does not cost us money. In fact, it saves us money and ensures quality recovery and support services whose costs pale in contrast to the cost of jails, emergency rooms, hospital stays, and intensive supports after the fact. I've spent years working to continue these investments, and I am honored to continue this work as part of a coalition of consumers, advocates, and providers, and I will not stop until we reach our goals. Thank you very much.
Good afternoon. My name is Rachel Bousquet. I'm the Executive Director for Kids Peace New England. Contrary to its values, Maine is failing its kids. I grew up in northern Maine, with a mother of two, despite working 2 jobs, needing benefits from the state to care for her family. Even as a child, I became aware of the cracks and blind spots in our system. But I also was taken under the wing of my community, and I realized an important part of the foundation of the value system. In Maine, we take care of our kids. Today, I see the dynamic in both my home life, where I'm raising my own family with children we adopted through state custody, and my work at Kids Peace, where I oversee Maine's largest program of residential treatment for Maine and children, in addition to providing critical early intervention and education services to children in many communities. As someone who grew up with Maine values, I have a passion for helping kids and ensuring their well-being. But I often find myself asking, do we really understand, maybe even appreciate, the state of children's services in Maine? Consider the fact that more than half of all children in the state require benefits from Maine Care. Or we could acknowledge that today there are more than 2,300 Maine youth are in state custody, and recognize that there actually means they endure prolonged stays in hospital emergency rooms, kept at Long Creek Juvenile Detention Center, housed in hotel rooms staffed by caseworkers, or sent out of care by the state. All because of a lack of foster families or insufficient capacity of the services in our communities. Those stopgap measures have two things in common. They're expensive, and they don't provide access to services that our kids need, only adding to their trauma. Wait lists for these underfunded options can stretch into months, if not years. Meanwhile, law enforcement, emergency personnel, and community behavioral health providers, in particular those in rural communities, are overtaxed, and parents and caregivers are at a loss in trying to navigate a complex system and advocate for their children to get the right care. In children's residential, the situation has become even more grim. Over the past 15 years, 4 out of every 5 providers have closed their doors, 642 beds to be exact, leaving 180 bed licensed remaining, a fraction of the former capacity. It's likely 2 or more programs will even close by the end of this year. Of those beds, only 20 are available for children with intellectual developmental disabilities. Because of staffing shortages, the system can only place 126 kids total in Maine beds today. Others are sent out of state. As in putting towards my remarks today, 70 children are residing out of state facilities, removed from their families, their friends, their communities, to only further complicate their treatment and journey in introducing further additional trauma. And out of 80 children currently awaiting residential placement, half are provided and approved to go out of state. Maine must adequately fund services here to ensure a robust and responsive full continuum of care rather than send Maine tax dollars to other states to deliver these services that we can provide in their home state, in their community. This is costing millions of dollars annually. And lastly, children in Maine do not need sympathy. They need us to step in. The scars of a broken system never disappear, and so much damage and trauma has already been done. But we still have time to rewrite the future for every child who is still in hopes for a safety, love, and a place to call their home. Because that's what we should expect from a state that takes care of their children. Thank you.
Good afternoon, my name is Hannah Longley and I'm the Director of Advocacy and Crisis Intervention with NAMI Maine. We are the state chapter of the National Alliance of Mental Illness, the largest grassroots mental health advocacy organization in the nation. Founded in 1979, with the Maine chapter established in 1984. Our mission is to provide advocacy, education, and support to so that all individuals, families, and communities affected by mental illness can live fulfilling lives. With this directing our work, we provide programming and resources to individuals impacted by mental health challenges, along with their friends and neighbors across the state. Through our work, we hear countless stories of individuals seeking treatment in various parts of the state. We hear from parents who are desperate to find support for their children struggling and managing behavioral health challenges. Over the past year, our helpline received 990 calls from individuals seeking information about mental health services and resources throughout the state. 418 of those individuals were family members attempting to support their loved one in accessing resources and support in navigating the complex system that they are dealing with. Many reported long wait times and access to community-based care, with 146 individuals attempting to support their loved ones during an emerging crisis and unsure of where to turn. During 2024, we also supported numerous police departments from various parts of the state as they responded to mental health calls for individuals in need of help, often with limited resources to respond. Androscoggin County is an example of it, with information collected from only 3 departments in that area. Yet cumulatively, they responded to a total of 1,767 mental health calls to support their neighbors in need. Our criminal justice system has unfortunately slowly emerged as the de facto mental health system in many parts of our state, with our officers seeking out information to assist members of their community and overcoming the barriers to receiving evidence-based treatment and resources to support them in their journey to wellness. As we move forward in advocating for change, it's critical to remember that we are recognized as the most rural state east of the Mississippi River, with parts even being referred to as frontier land. Mental health does not discriminate. So as we move forward in supporting the wellness of our friends and neighbors, we must remember that access to quality care is imperative regardless of the medical diagnosis or the area that they live in. By building a sustainable mental health system based on treatments that are proven to be effective, we are building a healthy state and a healthy future. The World Health Organization has stated that poor mental health is the leading cause of economic loss worldwide, and here in Maine, these statistics ring true. This takes an engaged workforce, sustainable treatment systems, and a lot of partnerships with all of us in this room. I live in a small farming community, and when a member becomes ill, we all band together to raise funds to support the family. We bring meals, we participate in fundraisers, we advocate to make sure that they receive the best possible treatment. As we move forward, it's vital to ensure that our neighbors receive the same attention to their diagnoses of mental health conditions as they do to their cancer or their heart conditions. We are proud and independent state, but we are also known for caring and nurturing each other. We have come a long way in destigmatizing our mental wellness. We must also make sure that we normalize ensuring that the same treatments and care is provided for it. Thank you.
Good afternoon. I'm so glad to be here today as we work together to increase the support and services for people who need behavior health services. My name is Mary Ann Moore, and I proudly represent the people of Senate District 6, which covers all of Washington County, along with 16 communities in eastern Hancock County as well. I feel it particularly critical to be here today because of the mental health crisis we are in, that we're facing. In my part of the state, access to services and programs is very limited, yet the need is great in my district and across the state. And when there is an unmet need, people's conditions is often exacerbated and they end up unnecessarily in emergency rooms, in jails, or on the streets. One of the several reasons we do not have adequate services to that, there's a huge gap in the work that needs to be done and the availability of people to do it. Addressing the workforce shortage is critical. Doing so is not just a healthcare issue, it is an economic, educational, and public safety imperative. Let's talk specifics. Right now, we have many residential beds and crisis beds that are empty and cannot be used, even though we have waiting lists for these services. The reason? There are not the people to staff these services. In addition, Mainers often have a 5 to 6 month wait for an appointment to see a counselor. Schools don't have adequate clinical staff to see all the students who need to see someone, and there aren't enough crisis workforce to respond when it is critically necessary. So emergency departments are overwhelmed with individuals in crisis, schools lack sufficient counselors to support struggling students, and law enforcement is increasingly tasked with responding to mental health emergencies. These gaps are harming individuals and families, along with straining our broader healthcare and social services systems. None of this is because we don't have excellent programs or we don't know how to help. So I'm excited that part of this package is a bill I am sponsoring to create implementation plan to increase the behavioral health workforce. There are initiatives that work in other states we can learn from. People working on the ground here know how to help, and our educational leaders hear from students what is most effective in increasing this workforce. What we intend is for this group to look at how we can feed that behavioral health worker pipeline and what resources are necessary to ensure we can retain the current workforce of staff and carry out the programs that will serve those in need. Everyone understands this problem, and while there is some work going on, and it needs to be augmented. It needs to be faster, and we need to implement what works. I also want to take a moment to recognize and honor the fact that so much of the work has been done to date is being done on a bipartisan basis. As Senator Talbot Ross and I know, these issues are not partisan. They don't have a partisan cause solution. The committees on which I serve, the HHS committee, regularly passes bills unanimously to address our mental health. I look forward to taking bold action together to determine how to support and grow our mental health workforce and in turn, strengthen the well-being of our communities.
Well, good afternoon. I want to start by thanking Senator Moore for her leadership, her years of work on this issue and for her leadership, and just also amplify that this is not a Democrat or Republican issue. This is absolutely a nonpartisan issue and affects all Mainers. I also want to take just a brief moment to acknowledge once again the legislators, our colleagues who are here with us today, Representative Stover, Representative Graham, Representative Gramlich, Senator Grahowski, and of course Senator Moore. We're very, very pleased that this is a group of legislators who have come together to move these issues forward. So as you've already heard, well, my name is Rachel Talbot Ross. I proudly serve Senate District 28, which is part of Portland, my hometown. And I also stand before you today to address one of the most pressing issues facing our state. You have heard about the critical need for deeper investment in behavioral health services across Maine. That is full stop. A deeper investment in behavioral health services across Maine. The reality we face is stark. Maine is experiencing a behavioral health workforce shortage that has reached crisis levels. This shortage impacts every single corner of our state, from our coastal communities to our rural highlands, leaving vulnerable Mainers without access to the care they desperately need. As you've already heard this morning, according to the Alliance for Addiction and Mental Health Services, Maine people struggling with mental health issues are currently facing an 8-month wait list for outpatient treatment, with 65% waiting 10 months or more, and our young people being sent out of state for care. All the while, agencies that provide these services are being faced to eliminate programming due to workforce shortages. This brings me to a proposal that I have placed before the legislature to consider this session. It is a bill to create an alternative pathway for social work licensing in Maine. The social work licensure exam, while designed with good intentions, has become an obstacle rather than a gateway for qualified professionals. We need alternative pathways to licensure that recognize the varied skills, experiences, and knowledge of those committed to this vital profession. By creating these pathways, we can expand our workforce while maintaining the high standards of care Mainers deserve. By passing this bill, we will help to eliminate the systemic barriers to entering the workforce, particularly for our low-income Mainers, our Mainers of color, and Mainers facing other systemic disadvantages. The consequences of our behavioral workforce shortage are particularly devastating, as you've heard today, and I will amplify, for our young people. When children and adolescents cannot access timely behavioral health services, their challenges often escalate. What begins as treatable conditions can develop into more severe issues that follow them into adulthood. The data tells a troubling story. There is a direct connection between unmet behavioral health needs in youth and eventual involvement in our criminal justice system. Let me be real clear. Our jails and prisons have become the de facto mental health facilities, and this is most expansive, and it is the least effective response. It's the most expensive and least effective response. The cost of incarcerating an individual far exceeds the cost of providing appropriate behavioral health services, but more importantly, incarceration initially exacerbates mental health conditions rather than addressing them, creating a cycle that is so difficult to break. I'm calling on my colleagues in the legislature to join me, Senator Moore, and all those who stand here in working to solve this critical issue affecting our constituents. The solutions will require collaboration and commitment from all sectors, but the return on this investment will be immeasurable in lives improved, families strengthened, and communities made whole. Thank you so very much for being here. Thank you again, Senator.
I'm Jane Van Bramer, Sweetser's President and CEO, and we are proud to join other colleagues and partner organizations today as part of the Behavioral Health Priorities Coalition. Our children in Maine are struggling. There is universal acknowledgement that we are in the midst of a youth mental health crisis. The concerning trends include over 1/3 of high school students report feeling sad or hopeless for weeks. The rates of anxiety and depression in Maine youth exceed national averages, and more Maine children experience 2 or more adverse childhood experiences. These aren't just numbers on a spreadsheet. These are real Maine children, real Maine families hurting. Without the right support, without easy access to treatment, children experiencing mental health challenges or at risk for them face an increased likelihood of requiring higher and more expensive levels of care. The costs of our legislation is a drop in the bucket compared to the costs and risks of hospitalization, incarceration, residential care, and other long-term strains on our system. We know that half of all mental illnesses begin by age 14, yet 49% of the children in Maine will not receive treatment, and even less will receive evidence-based treatment. That is treatment that works. An act to expand child-assertive community treatment, sponsored by Representative Lori Gramlich, is designed to change that. Child Act is an evidence-based treatment designed to support children to remain in their homes, in their communities, with intensive support. The Department of Justice specifically noted Sweetser's Child Act team as a benefit to our state, when previously Child Act was cited as a gap in Maine's service system. Child Act brings comprehensive treatment and services directly to youth with significant mental health challenges and their families in their homes so they can remain in school and together. We use a strength-based model that instills in youth and their families hope, goals for the future, and a plan for getting there. Accessing behavioral health services in Maine is difficult. Workforce is the primary barrier to service expansion. We can't have services without staff. What made Sweetser's Child Act teams viable was the addition of the incentives that supported training, hiring, and retention of Child Act's staff. Our legislation seeks $320,000 to expand this wonderful service and create 2 new Child Act teams in Lewiston and Bangor, both high needs and underserved areas. In addition, early identification and preventative interventions are the hallmark of an effective behavioral health care system, and in reducing costs to taxpayers. One of the best forms of prevention we have is embedding clinicians in schools alongside school staff members to reach those children with highest needs. An act to provide grants to schools that contract for behavioral and mental health services, sponsored by Senator Rachel Talbot Ross, will provide those critical resources needed to stabilize therapy in schools and prevent further cuts from providers of these services. Schools play a critical role in providing a safe, non-stigmatizing, and supportive natural environment in which children and their families can have easy access to early intervention and treatment. The purpose of this legislation is to improve student access to mental health and support students and families. Our school therapists work year-round and have literally helped thousands of children navigate bullying, depression, anxiety, parental divorce, and other adverse childhood experiences. Sweetser operates this program at a loss and supplements it with other programs and donations because we believe in its prevention mission so much. But it is simply not financially sustainable for any provider. And due to the loss of over $1 million this past fiscal year, Sweetser has had to reduce our presence from being in over 100 schools to now being in about 45. This bill will stabilize the program for all providers and ensure it continues. Now is the time to strengthen Maine's behavioral health system for our next generation. Together, we must meet this moment with leadership and expand access to programs that work, backed with the resources to properly staff them. The time to invest in our children's future is now. Thank you.
Good afternoon. I'm Julie Shermer. I am president of NASW Maine, which has 1,000 social work members in Maine and 7,000 licensed clinicians. We are the largest behavioral health profession in the state. I'm also principal investigator of the study last year that showed the long wait lists and huge vacancies, which I will add to today. So my points today are, number one, Maine's behavioral health workforce shortage, as we've heard, is reaching critical proportions with dire consequences to access. Two, new behavioral health grads are either leaving the state for greener pastures, such as Massachusetts, or if they stay, they fear being the first to go when cuts are made, joining the ranks of their homeless clients. And the last thing, we've heard many of the legislative policies that are proposed, some costing money, some not costing so much money. So I'm going to add to some of those bills. So the workforce shortage. Needs have been increasing and workforce threats are worsening from state budget deliberations, leading to gaps in Medicaid coverage and signs of federal cuts to Medicaid and Medicare. For the 20 years before COVID, mental health rates, substance use rates, and suicide rates have been increasing. The second point around the graduates. Agencies right now are reporting 21% vacancy rates for clinicians, in some areas worse than others. In recent testimony to the Health and Human Services Committee, Christine Daggett from Aroostook Mental Health cited 30% vacancy rates in their agencies. You can't operate with that amount of vacancies. The other thing is Maine is the oldest state in the union. So Maine's aging behavioral health workforce is retiring. And with only 10 clinicians available to replace every 13 clinicians who leave the agencies. So some of the other bills. The bills to address workforce needs is not just a one and done. There are multiple bills that we have in our package. We need to add to our existing workforce by passing Senator Talbot Ross's ASWB licensing exam alternatives for social workers. That has shown in states like Rhode Island and Illinois to more than double the number of new social work licenses in the state. And the new social work licenses, these are the folks who are going into the agencies. The second is bills to retain and recruit and retain people into the workforce. That includes reimbursement rates that cover the costs of care, loan repayment, recruitment and retention incentives, such as Senator Talbot Ross's incentives for school-based clinicians. And then the third is investigate workforce models that work, such as behavioral health community teaching organizations, similar to medical residency programs, paying for the supervisors and the organizations for providing the supervision, but also paying the interns for their placements. And then the Senator Moore's bill on behavioral health workforce legislation study. We need bills and we need services and policies that address multiple levels, from pipeline issues to recruitment and retention in agencies, and prevent us from having a two-tiered system where folks with the most severe and chronic diseases are not getting the level of care that those who are working and have private insurances are getting. So thank you.